Welcome to the Metabolic MD. Health means everything. We all seek optimal health, but most of us do not know how to achieve it. Dr. Paul Kolodzik has spent a career in the emergency department. Now, he helps his patients avoid ever ending up there. During these podcasts, you'll learn how you can lose weight and prevent and reverse disease through new technology, a modified diet, and the use of some new recently approved FDA medications. This information is not meant to be medical advice. Please seek consultation from your own medical provider. Let's listen in.
We want to thank our following sponsors, themetabolicmds.com, a boutique weight loss practice focusing on weight loss through modern technology, the latest GLP-1 weight loss medications, and health coaching. We also want to thank the CGM Doctor, where you can purchase a CGM without a prescription delivered right to your door and also find useful information to get the most from your CGM to improve your health and weight.
Dr. Paul Kolodzik, you're here, I'm here, and we're here to talk about my fatty liver disease. I had no clue I have fatty liver disease, but I guess the results said I have mild fatty liver disease.
Right.
So let me explain how we got to this conversation. I had some just kind of like nausea after I would eat. So I went to the doctor and they said, it could be a host of things. But we're going to do a ultrasound.
That's a doctor for you. Could be anything, right?
Could be anything. Here's, please pay at the counter. So they scheduled an ultrasound for me last Friday. I go to the ultrasound. I'm not pregnant, which is good to know. So they scanned and they sent the results back like that afternoon. But my doctor hasn't even looked at them yet. But I sent them to you. Figured you'd be interested in seeing what I'm dying of. And you read it and you saw what?
Hepatic steatosis.
What the hell is that? What does it mean to anybody?
It's fatty liver disease.
And why do I have fatty liver disease? I'm not overweight. I don't drink. Yeah. What only thing I am is a diabetic.
Right. And I think that's why. Because that blood glucose in your body gets converted to fat in the liver, causing fatty liver disease. So this is a takeaway I want everybody to go away with here today, is that you think fatty liver disease, I'm eating too much fat. That's causing, fat in my liver.
Kind of thought
it's not caused by eating too much fat in the vast majority of people. It's caused by what we've talked about on this podcast for the last couple years, which is high carbohydrate and processed food intake raises your blood sugar. Yeah. Blood sugar gets converted to fat in the liver, and some of that fat stays in the liver.
Okay, so first off, how would I know if I have not had, excuse me, a ultrasound? How would I know I have it? Is there symptoms?
So there's a whole spectrum of fatty liver disease now.
So I'm on the spectrum.
I've always known that, Terry.
Okay.
I mean, it's from very, very mild to very severe. This is interesting. I'm going to throw this in as an aside. I had a patient once that was an anesthesiologist, and he was an anesthesiologist on a transplant team at a well-known transplant center here in Ohio.
Yeah.
And they always used their liver transplants almost always used to be alcoholics that ended up having cirrhosis from their alcohol use.
Right.
But now he said that they really do many, many more transplants because of hepatic steatosis or fatty liver disease. So fatty liver disease at an extreme can cause failure of your liver.
So is a transplant common these days in livers?
Yeah, I mean, transplants fortunately still are relatively rare. Patients have to be selected appropriately for all that. But his point was 15 years ago, it was all for alcohol use.
Right.
Now the vast majority of it is for fatty liver disease.
Wow.
Which then causes, eventually if your fat infiltration in your liver can get so severe that it can cause liver failure and, lead to jaundice when people turn yellow, that type of thing.
Well, so tell me, what are symptoms? If I had not had the ultrasound and I hadn't sent them to you to say, hey, tell me what you think, what would symptoms of that fatty liver disease be for me?
Yeah, the symptoms really are generally just pain in the right upper quadrant of the abdomen, the right
Like
upper
sharp
part
pain?
of the abdomen. No, kind of dull, achy pain. So as the liver enlarges with fat in it, the liver is surrounded by a capsule, and it causes some pressure in there.
Yeah.
And when there is, also some inflammation, and that causes right upper quadrant pain. But the majority of people that, like you, that have fatty liver disease don't know that they have fatty liver disease.
So is there any other symptoms? Could it cause me the nausea that I was feeling?
Generally, it's more pain, so I don't think that your nausea was related to your fatty liver disease. But usually it's more pain. But for most people, you aren't going to know you have it
Right.
until it significantly progresses and you have a problem. So the data now is that 1 in 5 American adults have some type of fatty liver disease, either mild or more severe.
So I'm in the top 20%, is what you're telling me.
Yeah, you are, Terry. You're in the top 20% of a lot of things. Yeah.
All right.
So, it's something to be aware of, and it goes back to also something that we've talked about for a few years here. We didn't have this problem with fatty liver disease 40 years ago, and the reason is because we ate a diet that was higher in fat and lower in carbs. And again, going back to what I said, fat doesn't cause fatty liver disease. Increased carbohydrate, which raises blood sugar, does cause fatty liver disease. And so it's really the dietary changes based on the food pyramid and the processed food that we eat now that has led to this increase in fatty liver disease.
So they said I had mild, whatever that word was you pronounced. What's the word?
Hepatic steatosis.
I had mild.
Yeah, it's basically, think of it as infiltration, strands of fat in your liver.
Okay. That's interesting to think about. What can be done about it? So if I have it now, what can I do to get rid of it?
Okay, so let's first talk about how you diagnose this or know, how do you know when you have it. So the most common reason people would find out that they have significant fatty liver disease is when they have their routine labs done by their doc every year or every 6 months, and your liver enzymes are elevated. There are 3 liver enzymes that are checked routinely, and if those are elevated, they can be elevated for other reasons, but if those are elevated, then that can be a cause of fatty liver disease. Other reasons, more rare, include, for example, hepatitis or alcoholic cirrhosis. But for somebody that doesn't drink a lot, doesn't have risk factors for hepatitis, then having an elevated liver enzyme panel could suggest that.
So you saw my panel just a second ago.
Yeah.
I don't have the elevated enzyme level. So when you see that mild, fancy word pronounced, what does that mean? If you don't see the enzymes, but yet you see a little bit there, is that telling you anything in particular?
Yeah, it just means it's not that severe to start.
Yeah.
So the reason. So most people, a lot of times you won't have elevated liver enzymes until the disease process has progressed significantly. Okay, so you're down the road. So the way a lot of people have their fatty liver disease diagnosed is often incidental. For example, when I see patients in the emergency departments, patients with abdominal pain, we do a lot of CAT scans, and every day I do a CAT scan for abdominal pain. Usually has nothing to do with fatty liver disease, but the report comes back indicating incidental, kind of like yours was, fatty liver disease.
So do you think more people have it than we know of?
Oh, 1 out of 5, 1 out of 5 persons don't know that they have fatty liver disease. And again, it could be mild to start.
Right. And how long would it take for somebody like me who sees it mildly to progress to a bigger state? Or will will it just stay like this?
Yeah, for you, I think it'll probably stay. You keep your blood sugar under control. I think it'll probably stay.
I try.
Yeah, it'll probably stay not very severe.
But what is it, if I see it increasing, are there medicines they can give you? Is there some type of pill they can give you?
Control your blood sugar.
That's it, really?
Yeah, control your blood sugar. And for those other people out there that are not diabetic, it's weight related. For the majority of people, it's a complication of obesity.
Okay.
So,
Well,
The other way to get it diagnosed is an ultrasound. Sometimes when people, get an ultrasound just like you did, that's when they noticed it. But I see it the majority of the time when I'm working in the emergency department on CAT scans.
so a side note of this whole conversation is, I went to see the doctor. She goes, well, I'm going to send you for the ultrasound. I did. But she also said, try Prilosec,
Yeah.
right? I stopped by Walgreens and picked it up on the way home. A lot of my discomfort after eating went away.
Yeah.
What does that tell you?
That tells you that the discomfort you had was probably related to stomach inflammation and not related to your liver or gallbladder.
And stomach inflammation is what?
Well, stomach inflammation is just, think of an irritation of the lining of the stomach. It's just, some people get it because they have a lot of acid, a higher percentage of acid in their stomach. Some people get it because they drink too much alcohol. There are a variety of reasons you can get. Some people just get it, because they're unlucky. There's really nothing that they have done to cause it.
Is there any reason I can't just continue with Prilosec for the rest of my life? Is it going to cause me great damage to do this?
Yeah, I think you ought to use mostly Prilosec or acid-lowering medications like that are used kind of on a symptomatic basis. When you're having symptoms, take them. But if you aren't having symptoms, then don't, because they do have some side effects. I'm not an expert in this area, but I know, for example, in older women, there is a concern related to osteoporosis if you're chronically on Prilosec.
Well, okay, I'm not an older woman yet.
Yeah.
So, they say take one in the morning. I've been taking in the morning. I just want to make sure I'm not shooting myself in the foot somehow.
Yeah.
What else do we need to know about fatty liver
Well,
disease?
so the causes that, to summarize, are, basically a lot of sugar in your diet, drinking pop, fructose.
I did a long time ago, right? Drinking regular Coke. Boy,
Yeah.
There's nothing worse than regular Coke. I didn't think I could ever switch from regular Coke to diet, but 30 years ago, I did it, and a week later, I hate regular Coke.
Yeah, it's hard. Yeah.
I hate it.
Yeah.
I can drink Diet Coke, and I love it.
Yeah.
But regular Coke, I hate now.
Yeah. So sugars, refined carbs, processed foods, the problem of insulin resistance, which we've talked about and diabetics have.
Right.
Being diabetic because your blood sugars are going to be higher. And so more of that blood sugar is going to get converted to fat in your liver. So one of the most important things you can do is just control your weight and monitor your diet.
Well, the other thing about going back to Prilosec, and I've noticed this because I have a CGM that I wear, and I'm checking my blood sugar all the time. I've dropped by 30 points, right? My average blood sugar could have been 150, and now it's 130.
Because of the Prilosec?
Because of the Prilosec.
Yeah, I'm not aware of that, Terry. It may be out there. People can chat GPT it,
Let me
but
know
I'm
if you're
not
on
aware of
Prilosec
it.
and you see a lower blood sugar. I'd like to know if I'm the only one. Okay.
Yeah. All right. What else do you want to know?
I got my free medical advice.
You get free
I'm pretty happy
medical
with
almost every week. You get free medical advice.
If it's not for me, it's for a family member.
I don't get free producer advice.
Oh, I'll give you free producer advice. All right. Well, I guess we'll wrap up this podcast. I was just interested in hearing about my fatty liver disease.
I got to make one more plug. Okay.
Yeah, go ahead.
Okay, and that's for the use of a CGM.
Oh,
I
absolutely. I wear them constantly.
Well, related to fatty liver disease. If fatty liver disease comes from elevated blood sugar, then a continuous glucose monitor is a great tool, again, to help guide your diet so you can, decrease your risk or even reverse fatty liver disease.
Well, let me ask a follow-up question to fatty liver disease. If it gets out of control, what happens to me?
So the issue is liver failure. Okay.
Okay.
And liver failure obviously it's a life-threatening condition, like somebody that has bad cirrhosis. It's not pathologically, physiologically a similar process, but the outcome is the same. You can't live without your liver.
Can't live without a liver.
Yeah.
That should be a song. Okay. What else? anything else we want to talk about? The CGM?
I don't know. Other
What
than
about the book? You don't want to shamelessly plug your book?
Sure,
Go ahead.
Terry, I'll do that. But all people need to do is go to Amazon and Google the Continuous Glucose Monitor Revolution, and the best-selling book on Amazon on CGMs will pop up.
It is true. It is the best-selling book on CGMs. You wrote that about 2 years ago.
Yeah,
Before
coming up.
CGMs were over the counter.
Yeah.
And
Yeah.
now that they're over the counter and they're going like gangbusters,
Right.
your book's really kind of taking another whole new life.
And what's the best site to purchase an over-the-counter CGM on?
It actually happens to be a site that you're partnered with, which is CGM Doctor. And you can buy that anywhere in the U.S., correct?
Yeah.
Doesn't have to be
Yeah.
one you're licensed in.
Yeah, go to CGM-Doctor, and there it is.
Yeah.
So if you've been told you have fatty liver disease, consider a CGM trial. And by a trial, I mean put a CGM on the back of your arm for a couple of weeks, eat your normal diet, see what's going on with your blood sugar spikes, and then with a second CGM, you can begin to monitor your diet. Bring down your carb intake, bring
Right.
down your processed food and sugar intake, and reverse that fatty liver disease.
So you've been known to talk to people. If they come by the website and they buy a CGM, you've been known to have a conversation with them. Is that still taking place? If they got questions,
yeah.
you're
If
happy
you
to
want to
help
go,
them?
so again, I got to be a little bit careful. I can't provide medical care in states I'm not licensed in.
Right.
But one of the things I do for anybody that goes to the website and purchases a CGM, we're getting busier. So for now, I'll do a 10-minute consultation with people by phone to just talk to them about their best way to use the CGM. So when you go ahead and purchase your CGM on the website, you can schedule a time. I
Yep.
set aside usually 4 or 5 hours a week to go ahead and do these consults, just to have a conversation regarding what's your situation, what's the best way you might use your CGM. It's been in fact, I scheduled one today with a lady that actually wrote a review on CGM Doctor. Kelly, can't remember Kelly's last name.
Thank you, Kelly.
Yeah, thank you, Kelly. But go there and you can check out those reviews as well.
Well, the other thing on the website cgmdoctor.com, you offer health coaching. Now, those guys can actually remotely monitor your
Right.
CGM, right?
Right.
And they'll coach you about what's going on and help you out to understand how to use this thing and understand the data.
Right. So I have a handful of coaches that I've used in the medical practice
Right.
over the course of the last 5 years, and they've gotten very good at interpreting CGM data and giving advice to people on the use of a CGM. I can't do that to people in the states I'm not licensed in. That's kind of stepping over the line, but the health coaches can look at your data and guide you related to diet and exercise regimen and the most effective use of your CGM.
Hey, well, all right, we're going to leave it at that. Well, thanks for my fatty liver info. I appreciate that.
I think something else will kill you. I don't think the fatty liver disease is going to kill you, Terry. Maybe it'll be me, Terry.
It might be you. By the way, if I need a new liver, you would be the perfect one. Like, you are Mr. Healthy. I could give me your liver.
Sure, Terry.
Now, do they ever divide a liver in half?
I think there are, different. You can take a lobe of a liver and transplant it, I believe, out of my area of expertise.
But you're willing to be mine.
No, I have 2 kidneys, Terry. I would give you a kidney.
Really? I don't think you would.
I would give you a kidney, but I'm not giving you my liver.
All right. Well, folks, thanks for joining us again on this episode of Metabolic MD with Dr. Paul Kolodzik. We want to thank our sponsors, the CGMDoctor.com and MetabolicMDs.com. Thanks for joining us. Bye.